from skin cancer, breast cancer is the most common cancer among women in the U.S. It is also one of the leading causes of cancer death among women. And now catching it early is even easier here in Austin. Kelly Thames with Community Care is here to explain why. And you've got a clinic, one of many clinics on Breaker Lane. Tell us about the new service that you guys are offering now.
Sure. Well, just about a month ago, we started offering mammographies at our North Central location to uninsured and underinsured women. Previously, the only place that women could receive these services was through the Seton Healthcare Network. So as you can imagine, there was a very long wait to receive screening mammograms, which are most effective at preventing the cancer.
And you started offering these on-site mammograms about a month ago. How many women have you already seen?
So far, we've done 150 mammographies, and 16% of those have been referred on to receive diagnostic screenings, which means the doctor needs to look a little bit more into the mammography.
What age should women get their first mammogram, and is it different if you have a family history of breast cancer?
Sure. Most women should receive their first mammogram at 40, and then every 1 to 2 years after that. However, if you do have any signs or symptoms or family history, you definitely should speak with your healthcare provider and they can make the appropriate recommendation.
So after the first initial one at age 40, how often do you need to go back and get another one?
1 to 2 years. Your healthcare provider will make sure that the guidelines are being followed for that.
And so I know people need to set up an appointment with your clinic, but once you're there, about how long does the appointment take?
Our appointments are set for 30 minutes right now. The mammogram itself takes about 10 to 15 minutes.
And what about pain? I know I've never had one, but I've heard that they can be pretty painful, so what should people prepare themselves for?
Well, I've never had one either. However, I do have a mother and lots of family members that have had one, and they always say it is a little painful, but the pain is brief, and when you know that you are able to treat and prevent something early, it's something that you can deal with.
Got it. I know providing it at a low cost is important for you guys. You're reaching out to women who probably don't have health insurance, although you do take women that have health insurance as well. But how much does a screening cost?
Right. Well, at our clinic, we see Medicaid, MAP, CHIP, and we offer a sliding fee scale. So depending on the type of insurance, it can vary anywhere from a free copayment to $10 to Medicare, Medicaid are a little bit more, but it's very reasonable for an annual screening.
Got it. Kelly Thames, thank you so much for being here this morning. Some great information for folks to help prevent breast cancer.
Thank you.
Thank you. All right, we're going to pitch it over to David now, who's standing by in the Weather Center with a very busy morning for you.
Absolutely, Erin. We've been tracking actually some severe weather all morning throughout central Texas. We're taking a lot